and we'll get this going. So, okay, so basically what we have today is we're looking at TeamSTEPPS. And again, it's a tool that I discovered a while back with the military, actually. And it's a nice tool. I found it to be very effective, and it's a good way to bring people together. So with it, I'm George Vukotic. I've been teaching in the Patient Safety Leadership Program since 2013. I've taught a number of the different courses. I've enjoyed teaching it, and I have to be honest, I've learned a lot just teaching this as well as participating and being involved. How I got involved, basically I spent 28 years in the military, the last 8 of which as a health services administrator, and I became familiar with the TeamSTEPPS tool while I was at Walter Reed National Medical Center in 2013. They'd had some challenges before implementing the tool, and once they implemented TeamSTEPPS, their processes and the error rate went down significantly. So that sort of got my interest, and I've been working with it since then. And then outside of teaching at the UIC Patient Safety Leadership Program, I work with startup companies related to areas of innovation in healthcare and trying to develop new products and services and ways to implement technology in different environments. So it's a little bit about me. Today, what we'd like to cover is we'd like to look at some medical errors and the reasons for them, how TeamSTEPPS works, and then how you might be able to implement TeamSTEPPS as a tool. It's a nice tool that I like, or I found very helpful. And then we'll look at the tools itself and then some resources. One of the great things about TeamSTEPPS, there are a lot of resources that go with it, and most of them are available at no charge. So good things, and that's our agenda for today. And then at the end, happy to answer any questions you have. Okay, so To Err is Human is a book that came out way back in 1999, and for me it was very eye-opening having read it. I don't know if most of the audience has had an opportunity. If not, I think it's still very relevant today, the way things and errors come about. Very eye-opening book. That was followed a couple of years later by another book called Crossing the Chasm, which advocates for a fundamental redesign of the U.S. healthcare system. And there's just about 2 years ago now, a movie came out, the To Err is Human movie, a version of it, and they looked at some case studies and followed individuals that have gone along the way. But again, if you haven't read To Err is Human, it's a very eye-opening book, and it'll draw attention to a lot of different things. From there, the book basically looked at different types of error, broke it down into 4 categories. Firstly, from a diagnostic perspective, and errors and delays in diagnosis, and then even use of testing or inaccurate use of testing. Covered some in the diagnostic area, and you can see on the screen as well. Then in treatment, errors in treatment. One that continues to be is errors in the dose or method of using a drug. It continues to be a big area of error. And then preventative, and then other areas, including communication, which I have found, particularly working in a healthcare environment, communication can often be the biggest challenge in getting people to work together. So those are some of the topics in the book. If we go forward from here, if you look at the causes of death in the U.S., now the numbers, depending on what study you look at, are a little bit different. But again, you can see medical errors as a 3rd leading cause of death behind heart disease and cancer. And then if you look to the right side of the screen, you can see again, particularly the bottom one, 106,000 deaths per year due to negative effects of drugs, which is very, very significant. And I think if you look at our society, and a lot been in the news lately as well, some of the challenges with drugs. But anyway, so that's one chart on it. If you look at a U.S. News and World Report study, John Hopkins indicated numbers close, but a little bit different. And then if you go down to the highlighted yellow area, I think that's it's telling right there. The reason for the discrepancy is that physicians, funeral directors, coroners, and medical examiners rarely note on death certificates the human error and system failures involved. And then following that, the authors of the Johns Hopkins study, led by Dr. Martin Makary of Johns Hopkins University School of Medicine, have appealed to the Centers for Disease Control to change the way in which it collects data from death certificates. So that makes you wonder if those numbers are even higher. But I thought that was just interesting, particularly how deaths are classified, and often in cases they may not even be classified, which could impact the numbers that we're looking at. Something just to be aware of. Okay, why do medical errors occur? And this is interesting. We always looked at the provider as being like the Iron Man or Iron Woman that, has all the strength and keeps things going. But if you look at it, it's inconsistent schedules, fluctuating workloads, interruptions, fatigue. And again, most times, I know even in my case, when I go to see my physician, I want to be one of the first people in the morning. I don't want to be the person that goes to see him at the end of a 12-hour day. So the fatigue factor sets in. It's just natural part of life. So we have to look at how to address that. But then again, failure to follow up. Another one that I found is a big challenge that I saw quite often in the military environment was poor handoffs. And then along with that, ineffective communication. People just, it's time to go. They want to get out of there. So don't necessarily do the handoff in the best or most effective way. And then complacency. And then even lack of training. Another area that I've seen over the years is quite often we get a new technology, which we're impressed with, but then the individuals aren't trained on how to use the new technology. So something else to keep in mind is when you make changes in process, procedures, or technology, make sure the people you have are trained on how to use those tools as well. Okay, some contributing factors. If you look at it, again, from Johns Hopkins a little bit more, they've done a lot of work in the area. Unprecedented rate of growth in medical science and technology. And again, it's great to see the impact of technology and what technology can do. However, we have to learn how to incorporate technology effectively so that it does not cause more errors and leads to less errors. Quite often, not knowing how to use a new technology can actually make things worse than if we stayed with the old technology. So something to keep in mind. Population is living longer, so there's the good and the bad with it. They're living longer, which is good, but then there's also the challenges of quality of life that go with it, and how do we treat people in those areas as well. And then again, from there, the bottom category, healthcare delivery system is poorly organized. Having had a chance to go to other countries around the world, I'm just overwhelmed at the challenges we have in our society and the things we do. But again, overly complex and waste of resources, coverage. If you look at healthcare coverage, a whole lot of challenges there. But I don't know that we're going to solve them in the course of this webinar today. But something to be aware of that impacts how our healthcare system works. Another chart here I thought was interesting is related to life expectancy. And if you look at individuals born in the 50s, if you look at, Africa to the U.S., there's about a 30-year gap. You can see that individuals being born now and into the future, it's narrowed down to almost just a 10-year difference. So the impact of globalization, the sharing of knowledge and information will continue to shrink that gap. And as you can see, in some parts of the world, significantly increase life expectancy, and in other parts, not as much. But again, that ability to increase life expectancy and the things that go with it. And as we globalize, or as globalization becomes more involved and we get to work together with other people in other parts of the world, we should be able to have more and more of an impact there. Regardless, I won't read all of this, but TeamSTEPPS basically 2005 developed with the Department of Defense and the Agency for Healthcare Research and Quality. And it was originally come about because of communication and teamwork were the big areas. And that plays out, I will say, from what I've experienced, it makes a significant difference. And those are the key areas that have been addressed and continue to be. And if you looked at it, they looked at some of the driving factors from a military perspective. In the mid-'80s, they looked at the number of aviation fatalities and the cost. So cost is usually what gets people's attention as well as lives. And here you can see in this case, they had a significant loss of lives along with the cost. And then what was interesting, the vast majority involved were highly experienced aviators. So these were individuals that had the skills in their profession. And then what happened was the lack of communication and workload management. So it's not necessarily just having the skills. Providers go to school. They get a lot of education, they get a lot of training, but then again, when you put them in an environment where they have to communicate with others, sometimes the work environment is challenging. How do you put all those pieces together to make things happen? And then again, learning from the high-risk environments, here's a couple examples. They talk about a VA study, and a 6,000 root cause analysis was basically the contributing factor was communication or lack of communication was the issue with 80% of those 6,000 root cause analysis that they performed in adverse events or close calls. And then related to that, they looked at other environments, not just the military, but if you look around at nuclear power facilities, and then even if you look at emergency providers and responders, those are high pressure environments that can often lead to situations where it's difficult to follow a step-by-step procedure, and that brings in some of the challenges. So those were some of the environments they looked at in creating and developing the TeamSTEPPS tool. Another thing that I think stands out is they talk about the iceberg, or the tip of the iceberg is what you can see, but it's below the water or the breast of the iceberg that may have more of an impact. So you may have just a statement saying we believe in patient safety, but underlying it, what is the culture like? What are the processes and tools? So what is there to support what is behind the tip of the iceberg? So just the concept to keep in mind. Again, it's not just what you see. It's not just a slogan on the wall. But if you look behind it, what's the environment of the organization, the support behind the individuals, and what they can get done that follows along with it. If you look at implementation of TeamSTEPPS, it's basically to talk about a three-phase process. The first phase primarily looks at is the culture ready? You have to find an environment that's open to having a change or working with the TeamSTEPPS tool or a tool like TeamSTEPPS. So a big part of it is understanding, surveying the culture, and then doing some analysis. So that's here, site assessment. Then this is the key part, the cultural assessment, and getting feedback on that. I'll show you a little bit more in the next slide. And then, are you ready? If not, what can you do to change the organization or the climate? And unfortunately, too often you need something bad to happen to get the attention of the organization to want to change. From there, creating an action plan. And then as you get the action plan together, moving into phase two, which is training individuals on the TeamSTEPPS tools, how to use them, how to work with them. And then finally, implementation, and then moving it into an environment that's sustaining or self-supporting, and that's coaching and integrating others, monitoring what's working, what needs to be changed, and then having a mindset of continuous improvement to keep things going. So if you look at it from a phased approach, you can look at it this way, and this process can take anywhere from 3 months to a year in order to work through it, determining the readiness, getting a plan of action, and then actually implementing it and sustaining it on an ongoing basis. A little bit hard to read on this one, but here's an example of some of the questions that are on a readiness kind of assessment. And it basically asks things, do people understand what TeamSTEPPS is? Is the environment ready for change? There's a person named Richard Beckhart. His model on change is that change will only happen when the pain of staying the same is greater than the pain of change. So if you think about that, are people willing to change? And are they willing to do things? And hopefully it's not because of a bad incident or something bad has happened, but is that mindset there where they want to improve, they want to be better. And then following along with that, do they have the time to learn? Are the resources there? Is the support system there? And then sustaining the change. So a little bit of a questionnaire, that's what it looks like if you want to implement this in your organization and take it forward. And then actually the TeamSTEPPS tool itself, it looks at some different areas. If you look at the chart or the graph in the middle, it talks about communication, and I would agree that this is the biggest component, is being able to communicate. Leadership, do the leaders in the organization support this, or is this just another check-the-box kind of system? There has to be the support. And then the ongoing situational monitoring. How do you create common understanding? Of course, the materials, the training materials with TeamSTEPPS are very good, and it helps build that common understanding, that common language, and setting goals for going forward. And then mutual support. Do people see this or truly believe that this is a tool that can make a difference, or is it something that they just say is another activity that we have to learn? But it's a good tool. There's some good products in here that you can leverage in an environment. It makes things easier, and it makes adoption of the tool and creating an environment of support a lot easier. Okay, with that, they talk about the three surrounding areas. Again, knowledge, attitudes, and performance. And we'll get into that a little bit more. You'll see more as you get into the materials. And then from there, I want to let you know there's a lot of material available. So you can see that the instructor's guide, so for example, the instructor's guide covers everything from implementation in general to managing a course, and then it covers a number of specialty areas, everything from ambulatory care to even combat care if you're in a military type environment. Measurement is an important part of any process, and there are a number of tools to measure the impact and effectiveness of TeamSTEPPS. I encourage you to look at them, use them. These are not live because we're doing this in a webinar format, but after this, either Sean, who's helping run this session, or I can get you the document itself if you'd like the PowerPoint with the details in it. So again, it's a little bit about what you have. If you look at the instructor's manual and break it down by module, you have everything from an overview introduction to organizing teams, setting up the classroom, and PowerPoints come with all of this, so it makes it easier than creating it from scratch. You've got communication tools, leading teams, how do individuals lead teams, situational monitoring, mutual support, and then it goes on into a few other modules that include pulling it all together, change management, coaching, and measurement, implementation, practice, teaching. So a lot of good materials are available, and the great part is they're at no cost. You can get most of these materials at no cost. They're out there, and what I found is very easy to use. So that's there, and again, we will get you this if you want to click on the live links to have that. I did want to touch on a couple other things. One, there's a gentleman named John Cotter. He's out of the University of Michigan, and he talks about this change model. And it's his book. He's got a number of books, but actually one is called Our Iceberg is Melting. And again, his component is you got to start with creating that sense of urgency. Why should people change? Why do we want to get things done in a different way? Then building a guiding team. Who are your advocates? Who are the people that you can get to lead change? And then from there, deciding, what needs to be done? What's the vision? What's the strategy to get there? And then finally making it happen with communicating, empowering others to act. Again, it's not hiding things, it's bringing up the issues and rewarding people for pointing things out rather than punishing them for bringing up issues. Focus on some short-term wins. Everybody likes to be with a winner and get things going. And then don't let up. You got to stick with the process. And then in time, you will actually be able to create a new culture of support and one that drives the change further along. A couple of components of the teamwork process, just real quickly. They talk about briefs, planning up front, getting the team together, designating roles and responsibilities, looking at the goals, and then, big checklist, guys, big thing in the military as well. But if you look at the checklist, who's on the core team? What are the roles and responsibilities? What's the plan? What's the workload? What are the resources that are available? So up front, the briefing. Once you've got the briefing down, another step is huddle. I don't know how many of you do shift huddles or morning huddles to look at where things are, what needs to be changed. I think these are a great tool. I still see them used very effectively when there's handoffs between teams, changing from one shift to another. We're trying to get other individuals involved. And again, you've got the checklist here again for looking at problems, trying to address issues. And finally, the next phase is doing a debrief. We're in the military. We used to call this after-action review, and looking at what happened, looking at the processes, what happened, what didn't work, and again, back to the checklist of what can we look at, what worked, what didn't work, and what can we change or improve based upon that. So a good three-step process that I like to use and work with. And then from that, here's another one. They talk about barriers, and you can see a number of the barriers listed there. Some tools and strategies, the SBAR, the situation background assessment and recommendations or requests. You've got that as a tool, and then talks about a few of the other ones, including STEP process, and then the outcomes. The idea of creating, they talk about the shared mental model, which is basically having a common goal, a common vision, and looking at what you need to do to achieve where you want to go. With that, there's some examples. Actually, if you do Google, you can see a lot out there. I just pulled a couple of them. They talked about this one at Ronald Reagan Medical Center at UCLA, and focus here on communication. So they talk about how they use the SBAR tool in particular and how they were able to leverage that and improve communication with their Code Blue team. It's one example. Another one here at Sidney Kimball Medical College at Thomas Jefferson in Philadelphia, and this one's more about a process and procedure and how they were able to implement the process here, or the TeamSTEPPS process, to leverage a process related to procedures. And then again, Duke University Hospital, and again, another one in the nursing environment where they're able to leverage communications. There's a lot of studies, a lot of information out there. If you need any kind of support in trying to convince your organization that this is a good tool to use, there are a lot of studies out there that can refer to it. Okay, with that, the key goal is to create a culture of safety. That's our overall goal. And you could look at the different components. A big part of it is training, but then if you train people the right way, it makes it easy to meet things related to compliance and focusing on other areas. And again, the key is how do we innovate and continue to get better at what we do. This is an ongoing process, not just a one-off process. And it's how do we just keep working together to make things better. Another area they talk about is creating this overall culture of safety, or safety culture in the middle, and it talks about different components of culture, including informed culture, who manages and operates things, a reporting culture. Are people open to reporting things, or are they afraid if they're going to report something that they'll be the ones that are punished for bringing it up? I'm reminded of the, shoot the messenger analogy that comes up here. And then along with that, creating a just culture for individuals. They have the right information at the right place at the right time, and then tying that into a flexible culture where we know that our environments change from time to time. Sometimes things are slower, sometimes things become faster paced. How can we adapt to those things? And then finally, a learning culture, this whole concept of being a learning organization and realizing that we need to continue to learn. It's not just a one-off process, or once we get our degree or certification, we're done. It's a process of ongoing learning and development. So there's a lot more. I won't go into the details given the time, but again, there was a revised version in 2014. A couple of things that stand out here is they looked at an assessment module, and again, this is to help measure improvement. They updated the communications module because they found that one of the biggest challenges related to communication, and then an overall course management guide and more ready-to-use materials. So some things that are out there available to you. And then from there, a little bit about the history. It started back in the mid-90s with the Department of Defense trying to get it together. And then in 2005, actually coming out with version 1, 2014, TeamSTEPPS 2.0, which is a big improvement. And then finally, now they have advanced course, and there's other materials that are continually being developed in the area of patient safety leadership and leveraging tools like TeamSTEPPS. Part of this I just put in here, and we've seen more adoption of TeamSTEPPS as individuals that have learned it in the military have transitioned to civilian careers, so that gives them a basis to begin with. And then along with that, I like this slide here because it talks about the patient safety culture ladder. And on the one arrow, increasingly informed to increasing trust and accountability. And I look at the bottom one, pathological. Who cares as long as we're not caught? We definitely don't want to be in that environment. Prefer not to be in a reactive environment where safety is important. We do a lot every time something happens, and then getting to calculative. We have systems in place to manage hazards, going more to proactive, where safety, leadership, and values drive continuous improvement. I like that. And if you can even get to the predictive, this is where it really makes a difference. That is how do we prevent things from happening in the future, and how do we make things going forward. So I like that slide, some good components there. And then with that, I just want to mention the National Patient Safety Institute has some great recommendations around creating a culture and building it. They've got an 8-step model. It's here, and that's available as well. And then finally, I want to point out there's plenty of resources that are out there, no cost. So if you need to sell this in your organization, all you need is a little bit of time and initiative to get this going, and the materials are out there to help you with that. And then with that, I want to turn it back over to Sean Betcher to tell you a little bit more about the Patient Safety Leadership Program. Again, I've taught that since 2013. I've enjoyed it. I've met a lot of great people along the way. And then with that, Sean, you want to tell us a little bit more about the program?
Yeah, no, thank you, George, and thank you for the presentation. I know you are very steeped in TeamSTEPPS, so I hope everyone found that that information valuable. I did see, I think Joanne and Georgina here had typed in as we were presenting that they're wanting a copy of the presentation, so we'll be sure to send that to you, both Joanne and Georgina, after we're over here. But yeah, essentially, as George mentioned, he really is an instructor here within the Patient Safety Leadership Program at the University of Illinois at Chicago. And George, I know you've been teaching since 2013. What courses have you taught? I thought it was a number, like maybe 3 of the 9 that you've taught in the past. Is that correct?
I have, yeah. The one I teach now most often is the one related to leadership, but I've also taught on change, and I've also taught a couple other ones on process, and then the capstone as well when individuals do their capstone program. So I've got to say, from my experience, I've enjoyed teaching all of them. I like the way the program is put together. It's a step-by-step approach. They try to bring individuals along in a cohort kind of a model, so you build some good relationships along the way. And I'll say that for me, it's been very interesting because I'm not a physician, I'm not a provider, but I've worked in more from an administrative perspective, and it's great to learn more about the individuals that are in the program, whether they're administrators, nurses, doctors, or other individuals that are just involved in healthcare, and to see the different perspectives they all bring. Again, one of the big areas of TeamSTEPPS that it looks at is communication. And I think anytime we look at a healthcare environment, we have to look at the different individuals that participate and their background, where they come from, how they share their knowledge. And that's, to me, I see, big improvement by bringing these courses and individuals together, and I can see a difference as people go through the program.
Oh, that's great, and that's valuable information, I think, for all of us to know. So yeah, you've taught 3 of really the 9 total courses, as you're seeing here, that make up the master's program.
Yes.
So there really are 2 paths for students. If I know there's a number of students on the webinar that are kind of thinking about the program, but essentially there's a certificate or graduate certificate program that's really the first 3 courses of the master's program. So some students who may be working in the field and are not quite sure if they want to do a master's program will sometimes step into the certificate program first to earn that credential. And it takes really 3 courses or 8 week one course that you're taking per 8 weeks or 24 weeks in order to earn that certificate. And then the nice part about starting in the certificate is then those courses will apply to the program that's on the left-hand side here, the Master of Science in Patient Safety Leadership, so that you can move on to take all 9 courses. And George, you were referencing sort of the capstone project. That really is sort of the culmination of the Master of Science in Patient Safety Leadership degree. Could you talk a little bit about your experience in terms of helping students with their capstone projects or interesting capstone projects that you have seen?
Yeah, so I actually give everybody a tip right off the bat. Coming into the program, try to decide what your overall goal is, and every class you take, try to focus on tying it into something you want to accomplish in your environment. So whether it's working in an operating room, making things more effective in there, or scheduling, or whatever it is, if you come into the program or early on, if you decide, here's a challenge I have in my organization or in my work environment, how can I take the courses and apply what I learn in those courses to my capstone? It does make a big difference. And I've seen some individuals actually, it's to me a big feeling of satisfaction is when an individual comes through a program, builds their capstone, takes it back to their work organization and says, you know, the work I did over the last year or so in the program, I've been able to take back to my organization. We've actually applied things, made a difference, and we've seen some successes, you know, whether it be reduced costs, improve patient safety numbers, whatever it is. But that's where I think the greatest, for me, reward is that individuals, and it's always been my thing, it's, you know, learning is one thing. Being able to take what you learn and apply it into your work environment is another thing. And I think that's one of the great things about our program is that a lot of what you learn here can be easily applied to your work environment to make a difference.
Yeah, no, and I appreciate that insight, George, and that is really the reality of the capstone project is to be able to produce something, a work or a plan that is usable even in your current position. And so here is just sort of a sampling of the different types of capstone projects that people have, some of our graduates have recently completed, and then pointing out some of those that we find are interesting for a number of different students. Any capstone projects that you can think of, George, that and I'm putting you on the spot here, so I apologize, that really stood out to you that you heard from a student, either in terms of implementation or kind of on the cutting edge in terms of what they were looking to implement?
Well, of course, to me, I've had a couple students that have taken TeamSTEPPS or learned about TeamSTEPPS and have taken it back to their organization and applied it. So that's one where I've been able to be more of an advisor and a mentor. And of course, those are the ones that stand out as being happy. Some I don't understand technically as well. So if people get into some areas that are very technically focused in regards to procedures, but some people have done well with that. Like I say, for me, not being a provider myself, it's more to see organizational, more of me being an organizational or process kind of person. Those are the ones that I've been able to relate to, and in particular ones that have been done related to TeamSTEPPS or team leadership and development.
No, that makes sense, right? Yeah, it's your area of expertise, so it's always fun to work with somebody who's doing something that you know a lot about. That makes sense. Yeah, and then finally, I will just say, in terms of the range of the students that come to our program, I would say we do promote this program as extremely interprofessional. So when you're talking about huddle ups, right, it's not a huddle up that's just for the RNs. We're talking about huddle ups that are cross-disciplinary, and that shows in the program as well in terms of who comes in. Can you speak a little bit, George, to the student body that you've seen come through in terms of makeup, both clinical and non-clinical backgrounds?
Yeah, it's a big mix, and I'll tell you, it's been great. And we've even had international students, so it's been a nice mix. We have everything from medical doctors, providers, nurses, administrators, and it's been a good mix. Some people in the patient safety field, a lot of individuals that are new to it. I think to me it's always nice when somebody's already received a number of advanced degrees and they want to come into the program because they feel it's important to focus on patient safety. But I will say you do get a big mix of individuals, and some of the class I teach now has team projects in it, and having an opportunity to work on a diverse team with people that have different backgrounds, whether they be providers or administrators or related in some way, working in pharmacy, whatever it is. It's nice to see the mix, and I think individuals learn a lot about other areas by being in the program and going through some of the courses where there are team projects as well as individual projects.
Yeah, no, and thank you for that, George. I feel that what we hear back the most from students a lot of times is both this program being online and then working interprofessionally. Sometimes it's just talking with your classmates through a problem, and you don't necessarily have to reinvent the wheel, but maybe somebody's doing something somewhere else, either in a different discipline or somewhere else in the nation, and you can use that and apply that really in the middle of your program to a problem that you're facing within your current position.
Yes. No, I see a lot. I don't know if you want to call them side conversations, but you do see a lot of individuals running their current scenarios past others and people providing feedback from either their experience or things they've heard, or even passing along contacts to other people and making some connections that way.
That's great. Well, yeah, well, we will go ahead then now, and that's really the main part of our presentation. I know we had scheduled about a half an hour here, but we'll open it up for any questions that you may have. I will just put in the plug the fact that the next cohort that George had described earlier is starting here in the spring. So the spring here at UIC is actually in January, but the application deadline is still a little ways off in December, but we would tell you if you are thinking about starting the program to get started on putting those materials together now so that you can be reviewed and be ready to start and hit the ground running come that spring term, come January. But with that said, I'll go ahead and open it up to questions. Feel free to type those into either the Q&A or the chat, either questions about TeamSTEPPS, questions about the program, and I'll read those out loud so that we can all and I did see there were a couple more. It looks like Dee Dee and Pauline, you had asked for the presentation, so we will make sure to send that to you as well. Okay, well, one question here, yes, just to reiterate, when is the deadline for the spring? So the deadline for application to the program for the spring term is actually December 1st. The email here, onlineinfo@uic.edu, goes directly to the advisors for the program. I will be sure to have one of our advisors reach out to you with the explicit application instructions. And if anyone on the call, on the webinar has questions, feel free to email directly to onlineinfo@uic.edu if you have not been directly in contact with us, but I know a number of you have. Georgina is asking, is the program online? Yes, that is something that we should have probably pointed out there, Georgina, so thank you. Yes, the program is entirely online for the certificate. And then for the master's program, it is almost all entirely online other than a residency that happens here on our campus in Chicago for 3 days where you're essentially getting your capstone project approved. Are there other questions? And I apologize, there's a bit of a delay as these come through. To read. Okay, George, this one here is for you, and I think what they're basically trying to ask is there a scenario or an example that you can give of implementation of TeamSTEPPS that you saw that was very successful?
Yes. So when I was in the military in particular, well, I'll tell you the first thing when I was at Walter Reed, I was so impressed with how things were done out there. And again, they had some previous issues with medical errors. And as a result of bringing TeamSTEPPS in as a tool, I think they had the advantage that they knew they had to make some changes. So I hate to put it this way, but whenever you're in an environment where change is seen as having to happen, there's a little more openness to working with it. And I think in this case, at Walter Reed, and I've seen it as well in other environments, but not to the same extent where they've had the same challenges or the same number of issues related to patient safety. Again, it's creating that awareness, and hopefully you don't have to point to all the medical errors, but there are plenty to point to in most organizations, or even if you use the national statistics. And then from that, finding a couple of individuals that are passionate about the material, learning the material, and sharing it with others. I think that is very important. You know, when I teach one of the courses, we use a Harvard case study called Children's Hospital and Clinics, and they talk about how change happened there. Now, this is not a TeamSTEPPS environment, but it talks about the driving factors behind change. And one of the key components is getting individuals who are energized, motivated, and willing to spread the word about how things can change. And I think TeamSTEPPS is a great tool that can help you make change happen. So part of this is wanting to make change happen. The other part is having the tools to make things happen. And I think TeamSTEPPS is a great tool for that. So there is a little bit of an education process involved with it. It takes a little bit of time to schedule individuals. But again, from having worked with it, it gives people a common reference, a common frame of actions to look back to or to share from. And it makes things easier going forward when you have a good understanding of what will be communicated, how will it be communicated, the decision-making process, who's responsible, how to work with it, how to support it, how to question it if you have questions. And I think this whole TeamSTEPPS approach gives you those tools to make all of those things easier just in how to function in your day-to-day environment. Because, again, in a healthcare environment, quite often things get rushed at times, and there are some challenges with communications and change. And I think TeamSTEPPS provides a nice framework for working through changes and working through ways to communicate with others, and even through, decision-making processes, what to do to move things forward if there's a problem or an error, how do you escalate processes, and then even leveraging things like the huddles and to get things started, and at the end of the day, the reviews or after-action reviews to talk about what worked, what didn't work, and what could be better. So I've seen all of those implemented, not only when I first learned about this at Walter Reed, but as I've run clinics within different organizations myself, and it has made a difference, or I have seen it make a difference, yes.
No, thank you, George, and hopefully, Jeff, I think that was who asked the question. Hopefully, that answered the question. Here's one that I think we could probably both answer a little bit, George. So the question really is the program flexible? So I will say yes. For most students that are doing this program, they are working full time when they're doing the program, and the program in and of itself is the term that we use in online education is asynchronous, meaning you're able to actually log in at any point in time to complete the work. So there will be weekly assignments and there will be due dates, but if you have time within your schedule at midnight or at 2 p.m. We know, especially people working in healthcare, those schedules can range in terms of when you have the availability. So know that in terms of enrolling in this program, you do have that flexibility to log on at any point to sort of complete the work. And I say, George, maybe you could talk about a little bit, how people sort of, your experience, how students have dealt with that in the past.
No, I think it's, the part of it that you mentioned, it is asynchronous, which makes it very flexible. So people working different shifts, different schedules. There are, for the most part, weekly assignment or unit assignments. And I think it's just a matter of getting it out there. The instructors I've seen, I try to be very diligent in getting back to students. My goal is within, 48 hours latest, 24 if possible, to respond to students. And then I think we have what they call discussion boards, where people post questions or issues and challenges. And then we ask individuals to look at other people's comments, some of the challenges, some of the things they post in these discussion boards, respond to them, and then also at times ask people to give feedback. If they've seen something similar. Earlier we spoke about, creating an environment of support. We try to do that in the program as well through using these discussion boards where an assignment is posted. Individuals respond to questions in the assignment, and then other individuals provide feedback to what that person posted. And quite often that learning process helps as well. And I think in some cases it's peer-to-peer learning as well as learning from the instructor.
Yeah, no, that's very helpful. The other part that another question I'm seeing here too is essentially do you need kind of a background in scholarly writing for the capstone? I could take that, George, but maybe you can speak to it first.
Go for it. No,
Yeah,
go. Yeah.
no, yeah,
Again, what I'll tell you, so that the challenge for me, and it's an ongoing challenge, is not necessarily the topic, because I think finding topics you're interested in is a good way to work. Always the biggest challenge is they want you to follow this APA format, but now there's actually tools out there where you can leverage to get the APA format to do your reference checking and everything the right way. So no, I think key to that, or with the capstone, come in with something that you have an interest in, try to focus on that, and then start working on your paper early. Don't wait till the end of the program. As you go through the classes and you learn about leadership or process or change, look at how you can take those different topics, or from the courses, look at the course descriptions and look at how you can apply what you learn in those courses to the overall project you want to have. Now, that said, I know not everybody figures out the project they want to work on, up front, but as you go through the program, use the courses to see if there's a certain area of interest, one of the courses or another, if it's related to compliance or whatever area. If that's an area of interest for you, I think that's going to make the capstone easier for you to get done. So those would be my thoughts from, having been in the program for some years now.
yeah, and I will, in terms of just saying, really, you do not have to have a background in scholarly writing, right? Ultimately, a number of the students don't when they're coming into the program.
Correct.
So know that really the faculty members, your mentors, the people that are here will help guide you in terms of completing your capstone. So if there's apprehension there, that's really the learning that will happen for you.
Yes.
Another question here, for the 3-day residency, do you provide your own accommodation? Will we be on the main campus? Asking from an international student. So ultimately, when that time comes, Georgine, I think you're asking this question, you'll have, you'll be given sort of where you, a time frame. It usually happens about halfway, so about 9 months into the program. We're not necessarily providing accommodations, but we will give you a list of where you can come and stay, and we do try to give you plenty of time prior to you coming in to actually do the program to know where.
And Sean, just to add,
yeah.
so the school and the program's close to downtown Chicago, so you are in a major city. It's not like you're in a remote part. So you are right in the heart of Chicago, and it's easy to get around. There's plenty of lodging, there's plenty of transportation, and so that should not be an issue for anybody that's concerned coming from another area.
Yeah. Then I think just a clarification. So there's no specific time that you have to be online to attend class. So essentially, no, there really is not. And another element as well, just to add on to that in terms of flexibility, is let's say for a number of our students, if you start the program and then you're needing to take an 8-week session off or a semester off, you can do what's called stopping out. So you do have that flexibility to take some time off once you enter the program and then come back into the program. And you really work with an advisor in order to do that, along with faculty members and really the program director. Do students who go through certification program and cohorts, or are they completed individually? Do students, sorry, let me read that again, Elaine. Do students who go through certification program and cohorts, or are they completed individually? So anyone who's starting the certificate program, you would be in class with the master's programs when you begin. So that you would go together with those same students all together in one cohort. Hopefully that helps, Elaine, but feel free to type back in again if I'm not answering your question. Another question here from Becky. Do discussion board posts require citation of resources, or is it more of an experience-based conversation and discussion?
I'm going to say it's a little bit of both. So if you have a good reference, I would say include it. Sometimes your responses are based on your personal experience, and that's fine. But also it helps if you've read an article or you have some background that you can reference back to it. It does help.
So hopefully that answered the questions there for you, Becky and Elaine. If not, you can definitely feel free to
And if it helps, people usually post and then we say, put a response back. And I'm not certain on all of the classes, but we usually say, between 250 words and 500 word response to someone. So that'll give you an idea of, what the expectation is, not necessarily a requirement. But if you think about it, somebody puts a post out, and then I don't think it's that much work to put in, 250 word to 500 word response. And if you want to include a citation, that's helpful. But again, I think that might give you a little bit. So people put a conversation, or the instructor will put a topic out there to say, tell me about a time at your organization where teamwork didn't go as planned. You give an example, and then you post, what were the issues, what you've done to solve it, and then other people might respond back and say, oh, I've used this TeamSTEPPS tool and it worked really well, and oh, by the way, here's a couple of reference documents, or here's something. And that might be an example of a post. But if you figure a lot of them are in the 250 to 500 word responses, that might give you an idea of how things work.
Well, thank you, everyone. And these are great questions, everyone. So I know we are running a little over time, but if you really do have more, feel free to type them in here. I'll kind of give that silent count. But otherwise, I don't know, George, anything else that you would want to add either about the program or TeamSTEPPS as we're sort of wrapping up here?
No, I got to say, from like I said, I've been teaching in the program since 2013. I like what's out there. I think it brings a lot of people together. I will say courses don't get overly big, so you never have to worry about having like 40 people in a class. The courses I've had, usually have, I'm going to say anywhere from 10 to 15 is a good number, sometimes a little bit more. But I think it's a manageable number where you can still get to communicate with everybody. Using a cohort model, it's good to get to know people. So from that perspective, it works well. Again, I'd mentioned, working on the capstone to be prepared for that and to work through that. That's probably the most work. But again, it's not unmanageable. And the parallel I give, it's, when I worked on my dissertation, it's you go from having class to class and you're given the assignments, with X amount of tests, X amount of this, X amount of that in a certain time period. Now you get to the capstone, and a lot of it then shifts to you and your desire and your motivation. So I think that's something to keep in mind. I think we're fortunate. We have a lot of good advisors to help individuals get through the capstone. And if you look at the instructors in the program, there's a wide variety of instructors with background as well that can help. And what I've seen and what I've involved with is if I may not have certain expertise in an area, maybe a topic in nursing, I can reach out to one of the other instructors that has a nursing background and that pull them into a conversation as well. So I think there's a lot of flexibility. I will say from, having worked in other education environments, it's a collaborative kind of environment where people want to help each other and try to get through things. And yes, those would be my thoughts.
Oh, thank you, George, and yes, and thank you for the presentation as well. I know I learned something about TeamSTEPPS. I was not overtly familiar, so I hope everybody that was on here today did learn something. And I will just give that final plug. You definitely will be hearing from advisors from the program once we have completed the webinar today. I will be sure to send copies of the presentation to each of you who had asked for that. But let us know if anyone else is wanting that. You can email us at the onlineinfo@uic.edu. And again, there is still time to start for that spring cohort starting in January. And again, that deadline is December 1st. But yes, again, if you have more questions, you can either email for either the program or for George, feel free to email onlineinfo@uic.edu, and we will get you back with a response. But again, thank you, George, for the presentation, and thank you, everyone, for joining us today. And everybody have a great day.
Thank you.